meantime, I can just introduce this. So we're going to have the next hour, as Sarah just mentioned, to discuss the topics and questions that were presented in the first two talks. And the purpose of the discussion is to provide input to the program to help inform planning for future studies, including community biomonitoring projects, and to identify opportunities for other collaborations. And so we're going to start by going over the informal discussion questions.
Okay, so it looks like I went to share and it said I can't share because somebody else is sharing.
I popped them up while I popped them up first.
Okay, fantastic. Thank you for being quicker. Go ahead.
All right, can we advance to the next slide? Okay, thank you. So the first topic for discussion, I think we're going to go through all of them and then begin the discussion, is my understanding. So first we have the potential use of the Genetic Disease Screening Program, or GDSP, samples for statewide surveillance. And some of the questions to consider are: what design considerations should we take into account when choosing GDSP samples for use in statewide surveillance, such as focusing on certain geographic regions, time periods, or demographics? Are there other factors that we would recommend? And also, since it will not be possible to directly interact with individual participants, do you have suggestions for how best to share these results with affected communities? So then I think we're going through all of them. So can we move on to the next one, please? Okay. Next is potential additional program studies overseen by the California Department of Public Health, CDH. So if the program has the capacity to take on additional small projects beyond the current plans, such as statewide surveillance, do you have suggestions on promising collaborations to pursue, or ways to identify promising collaborations? And which program goals are most important to consider as the program evaluates potential projects? Next, a set of questions and things to discuss is future studies related to advancing AB 617 goals overseen by OEHA, the Office of Environmental Health Hazard Assessment. And the specific questions are: can you recommend existing research projects that align with AB 617 goals and to which a biomonitoring component could be added? For near-term planning, the program is especially interested in projects that are working with a community partner, enrolling participants over the next year, being conducted in geographic areas that have not yet been studied by the program, collecting complementary exposure and health data. And the program is planning to issue a request for information, or RFI, to help identify potential opportunities for future community biomonitoring studies. And what other types of approaches could we use to identify such opportunities for both the near and the long term? And which factors are most important to consider in evaluating these opportunities? Okay, let's see. I think next slide, please. So another topic for discussion is collaborations to analyze existing program biomonitoring data. So there was the presentation earlier discussed the type of information that could be included in a data package, and what other types, if any, should be included or could be included to be shared with external researchers. Do you have ideas on specific partners to reach out to for these types of collaborations? And what approaches would you recommend for publicizing this opportunity? Okay, I think next slide, please. So finally, options for additional biomarkers related to air pollution exposures. Do you have specific suggestions on additional biomarkers for air pollutant exposures that would be worth pursuing? Do you have specific suggestions on academic laboratories in California that could be potential collaborators to develop methods to measure additional biomarkers? Okay, thank you for doing that. And I guess we can, we don't have to do them in that order. We just please, if you, I'm going to ask attendees who wish to speak to alert us by using the raise hand feature in the Zoom webinar so that I can call on you. And so let me go ahead and start. It looks like we already have a raised hand. Tom?
Yeah,
you're
let
up.
me just say, Ulrika, I'm going to tell Elizabeth, why don't you take that, those discussion questions down? If people want to refer to them, they're posted on our website on the meeting page, so you can flip through those. And I agree with you. There's too many questions actually to cover in an hour for sure. So we put the ones first that we really want to focus
Okay.
on, and then we can deal with other things later. So we can kind of check in over the hour and see where we're at. But please also, people, feel free to email us with your input on any of these things at any time. Okay, back to you, Ulrika.
All right. So Tom, you have a question or a comment?
Thank you. So I think this question, it occurred to me early on in the presentations and kind of reoccurred in a couple of places. And what it is I particularly resonated with the discussion about the biobank and the non-biobank and the ability to do time trends. And I think time trends are very important for understanding. If you think back over many years of where we're looking at things that we find, in biomarkers, the question is this something new? Is this something that's been there, we just never looked before? Is this something that's going up or going down? I mean, the time trend is one of those fundamental questions. So having the capacity to track time trends, I think is very key. And so one of the thoughts I had, especially I was looking at the biobank. It's not complete, but you can do time trends with the materials they had. But even if there's, what I think the program needs to do is look at opportunities for continuity. So anything that exists that has a time trend, as you're looking for new things, at least trying to match up enough so that we don't lose the ability to cross over when we go to a new study where things are a bit different and everything's collected. It'd still be nice to figure out some mechanism to normalize our measurements or to make sure there's some continuity for things that we already have a rich time scale on or a time trend. And again, I think that kind of relates to several questions here, but I did want to bring that up because I think that's been one of the really powerful features we've had in biomonitoring is to watch what's happening in populations.
Thank you, Tom. I'm looking to see if there are any other raised hands at the moment. Let's see. Not seeing any, but everyone has, Narissa and Jose.
Well, thanks for your comment, Tom. I agree that biobank gives us this unique opportunity to look at a steady source of samples over an extended period of time. I guess the question is whether, we have to choose one focus of sampling so that we have sufficient power to really look at something like time trends. And so the question is, are time trends more important than, for example, pulling samples from different geographic regions? Or, is it more important to look, in comparing non-biobank to biobanked things, is it more important to be able to go back to the past, back to the 90s or to the 2000s? Or would we want to be able to look at some geographic diversity, for example, comparing, inland to the coast or something like that? So I agree that this is a really important, they're all important. So we're looking for some clarity on what is the most important for us to sample towards.
Well, so I think if I can respond, right, I don't have to wait to raise my hand again. Okay.
Yeah.
No, that's a great question. And the real challenge is, like, if you can't do both temporal detail and geographical detail, I don't, I kind of defer to others. I think if I had to put a little more weight on what are the other, I might put more weight on having time trends, just because there are so many things where there are co-pollutants and other issues that if we just had a lot of geography and just a lot of snapshots, it's kind of like, where do you want photographs and where do you want movies? And like lots of photographs could be, tell you a lot, but you might want to, if we lose the ability to see something of what's happening in time. So I might weight them a little, weight the if the resources are limited, I wouldn't put it all into time, or in terms of preference, I wouldn't put it all on time trends. But maybe, 40-60, 30-70, like 30. If you have a priority, 30% or 40% priority to geographic, and then 60%. If I had to, again, that's just, I would welcome anybody else's view on the alternate approach, which is maybe it's better to focus on geography, but it's kind of my own. And that's just I think from sitting on the panel a long time, I think we've had impact where we've seen time trends, something rising or something falling.
Okay, thanks, Tom. Jose, do you want to?
Yep. I was
Chime
just
in
going
there?
to call on it.
Yeah, well, since we're talking about that, I think it's an interesting piece that California Biomonitoring should start thinking about what to prioritize, because they're very different questions. One question is asking how have these exposures changed over time. The other question is, are there differences across populations right now? I think they're both answering very different questions, and I think they're both worthy of knowing, but I think this is more of where's the program headed towards. And what I'm trying to get with that in addition is what types of partnerships you could start developing, right? So do you want to bring in, for example, cohort studies that have been sampling and collecting all these biospecimens for decades and measuring different compounds in that as one of those sources, versus focusing more on newer studies that are recruiting participants versus doing something of your own. And one of the examples, for instance, with Rancho Bernardo down here in San Diego County, there was this study published by Paul Mills a few years back, just looking at the temporal changes of glyphosate that had been measured over time. And this became, I think, a substantial contribution because nobody had looked at glyphosate before. You can look at the changes. But I think this becomes maybe more of a deeper question with regards to what types of biomonitoring should be prioritized into what amount. And I think that would also shape your RFIs too, since you want to start collaborating with community. Then you probably have been considering having two different general sections of RFIs. One which would be, we want to have more information about these particular topics which are of most interest to you right now as California Biomonitoring. And then the other one, which is open to community, right? Because there's this big movement to have the community also be involved into designing some of these studies. So it might be something that you have to have a balance, but it might be good to have these two different RFIs, one that's more guided what you want, and the one is more a community, see what the community wants.
And one thought as I was hearing Jose and Tom's comments too, with the time trend versus geographic diversity. I mean, obviously, I think that can be informed also if there's a reason to believe that there's an emerging contaminant, or there's been some sort of an intervention. For example, when the flame retardant content law, I'm blanking on the legislation, when that was changed, to be able to track to see whether flame retardant levels declined over time. So that would be a situation where you might want to do a study looking at the time trends versus, as Jose said, it really depends on the questions that are being asked. But if there's a reason to believe that there might be time trends, that might be a situation where that would be what you would want to focus on for a study.
A natural experiment, and TB wants
exactly. Let's see, is there any, I'm looking for other hands raised. Jose, you still have your hand up, or did you have another comment? Or no? Okay. All right. So that was really kind of talking about statewide surveillance, just to kind of refresh everyone. So we're also the next topic is potential additional program studies overseen by CDPH, and then future studies related to advancing AB 617 goals overseen by OEHA. So we could think about those. One of the one, I could maybe add some things because I've been thinking about an AB 617 as far as AB 617 studies go. So there's been a collaboration here in Orange County with the city of Santa Ana. The Madison Park Neighborhood Association is collaborating with researchers at UCI, including June Wu and professors in the Department of Chemistry, Barbara Finlayson and Pitts. I'm also have been involved in the project. The Madison Park Neighborhood Association is concerned about air pollutants. It's a neighborhood that's predominantly Hispanic. They have not applied for AB 617 status, but they do have multiple areas that come up as very high on the CalEnviroscreen tool. So they have an ongoing collaboration, concerns about air pollution as well as industries, because it's a neighborhood that's near a heavily industrialized area. So I just wanted to mention that as a possible collaboration with an ongoing study that's looking at air pollution, including PM, as well as contaminants from some of these industrial sources, a lot of metal processing facilities, among other things. So if other people have, Tom, I see you have another.
Actually, we have two comments in the chat. Apparently,
Okay.
Dr. Sunshine was having technical difficulties.
Okay,
So I'm gonna invite her, and then we have another
okay.
comment from Charles.
Yep,
So let's
I
start
see.
there, and then we'll go back to
Yep.
panel members.
All right, so we start with Dr. Sumchai?
Yeah, so there's a comment from Dr. Sumchai. I would like to contribute to the discussion topic on complementary exposure and health information from our experience at HP or Hunters Point Biomonitoring. We are also looking at patterns of essential nutrient deficiencies and have embarked on a geospatial mapping of deficiencies in iron, calcium, selenium, zinc, and magnesium to triangulate with toxic metal detections. Thank you for that comment. And should I move on to Charles?
Sure.
Yeah, why don't you go ahead and cover Charles' comment? Thank you, Charles. Go ahead, Cheryl.
Okay, Charles Patton commented NDAA authorized funds for states regarding PFAS cleanup and included funds for biomonitoring military personnel living on site. It might be interesting, if possible, to include this population. Could be interesting comparison regarding time change and military population compared to non-military populations. And then there's a second comment from her. Firefighters are concerned with exposures to chemicals that adhere to particulate matter in smoke. Firefighters suggest that their exposures are no longer unique, given smoke plumes that may expose populations downwind from a wildland urban interface exposures. The incidence and WUI fires is expected to increase given increased heat and drought conditions throughout California. Thank you for both.
Yeah, thank you very much for both of those comments, and thank you for reading them to us. I see that Jenny, you have your hand raised.
I think Tom was before me.
Oh, okay. Tom?
Yeah, well, thanks. Well, and I do want to follow up. So there were two points that really fall into a theme that we should think about. And I think Dr. Luderer made the first one about, CalEnviroscreen and kind of jumped over. And then, I'm reading Dr. Samshai's comment about looking at nutritional deficiencies, looking broader at factors in the community. What I think what occurred to me actually before some of this, but got it reinforced, is that CalEnviroscreen and other things are tools for helping us drill down to find hotspots of stress. And we tend to be focused maybe on just one thing, like chemicals or PM. But actually, I think we might want to consider that patterns of disease arrive from multiple interacting stressors, like lack of access to food, lack of access to healthcare, the stress that comes with poverty. And then I think some of the things we're missing is how to measure these. I mean, we can calculate it with CalEnviroscreen, but we might want to think about looking at other kinds of effect markers or even things that tell us more about the stress of the population. So we could target some of our other biomonitoring to really focus on populations that are already heavily burdened with other factors. And again, this is a bit ambitious, but I think it's a direction that a lot of research is starting to go to look at multiple stress factors overlapping and how they relate to disease burden at maybe the census tract or community scale.
Thank you, Tom. Jenny?
Hi, I start by talking about the AB 617 related questions. I'm very fortunate to be able to work with border communities, including the community of San Isidro near where the Highway 5 goes into Tijuana, which is one of the busiest border crossings in the world. And the community is very impacted by traffic. And so thinking about how AB 617 can be really supported by California biomonitoring, I think one of the key questions is, what does biomonitoring add? Because if you have a question of how far does this pollution extend from the source, I think that air monitoring is very good at answering that question. So I think what biomonitoring adds, as we all know, is exposure by all routes. It also incorporates activity level, so, and body size. So you can imagine a child on a playground near the 5 and 805 where they come together in San Isidro, running around is going to have very different body burden than the teacher maybe standing in the shade and watching the kids run around. And so I think that really helps communities understand where exposures are highest, including personal factors. And so I really think we should always look at it through the lens of what biomonitoring adds to the question. And I think it can really show big disparities. A school that has an air-conditioned gym versus a school that doesn't. So at the other lens, I like to shine on that with biomonitoring is the effect of disparities. And these could be structural, like having an air-conditioned gym to play versus playing outside near a freeway, or it could be other disparities we've already talked about. So that's kind of a broad comment. So I guess, but that's my thought thinking of AB 617. And again, I think just given vehicle exposures as being a major source of pollution in California, that continuing diesel biomarker work and also looking at markers of gasoline vehicle exposure and looking at the disparities in body and exposures to vulnerable populations would be a focus. And I could stop there if you want. I have other comments, but I might as well stop and let someone else talk, and then I can come back with a different question if you want. Thank you.
At the moment, I'm not seeing any additional hands raised. So if we wanted to add some additional comments, please do.
This is to do with the mission of statewide surveillance and looking at exposures over time that we had the discussion that started this conversation. I think that in terms of the biobank samples, it was my understanding that we could go forward on geographical diversity by requesting the samples, but they were only archived for a certain geographical area, right? So if we look at time, it has to be based on that geographical area, was how I interpreted the slides. But I think perhaps to do both these things, we should request them in a larger area going forward, so we can actually look at that time rather than looking back in time, try to collect and request and move forward with the samples. So one question it has to me is, over what time frame are you asking for advice? Is it what you should do the next year? Or what should you plan for in the next 5 years or 10 years? So it kind of changes my answer to that question.
Ulrika, could I respond
Yes,
to that?
please do, Nerissa.
Okay. Well, I think we want to sample in a way, like we don't want to go one way next year, then change direction the following year, because the whole part of the trying to think through the sampling plan is so that we have enough power to really answer a question rather than having a few samples for one question, then a few samples for another question. So we're really trying to get an idea of how this cumulative body of data will serve us. You are correct that for the biobank counties, so for those 7 counties, we can go back in time to, I think it's like 1995, and then continue the time trend. So if you're trying to answer a question of how have PFASs changed over this longer period of time, or, you know, are there other PFASs being introduced at certain time points, we would want to go back in time. If the question is from now, how are they continuing to decline, or are there new PFASs being introduced starting from, you know, whenever we pick our first sample batch, then we could go from any to any county and look at that decline. I think it really depends on whether you're interested in looking at that past, and whether there are points, relevant points of new PFASs or other compounds being introduced that we would want to be able to look at.
My other question, I guess, to you while you're answering these questions so nicely is, my memory was that we were limited in the different analytes from some of these archive samples because they were not collected in the right kind of tubes or stored in the right, you know, kind of buffer or whatever. So I think it might be helpful to kind of remind us what we cannot measure in those samples, because that might be important too.
Right, so it's only a serum sample to start with, and the serum separator gel does have trace levels of metals. So we did do some trials with metals, and we just found that we couldn't adequately correct for that contamination. So we can look at PFAS, we can look at POPs, but one of the limits for POPs is that the archive samples, we only have a 0.5 mil or more or less sample. So we don't have enough to send out for a lipid sample in addition to the POPs analyses. So we have done some POPs work by just picking the samples for which we have enough serum. So there are definitely limits to those biobank samples and what we can do. Junsu might be able to talk a little bit more about the volume of sample that's needed for PFAS as well as non-targeted screening, and if there are other novel analyses that he might want to run on serum samples.
Yeah.
Thanks, Narissa. Does Junsu, do you want to comment on that now? And then I also see that we have a comment from Yunha.
I would go ahead with Unha.
Okay. Yunha, go
We
ahead.
can get back on the
Okay.
volume of issue.
Yeah, I mean, it's a little bit extension to the previous conversation, but a little bit changing the subject that I'm kind of wonder, you know, it's always challenging to find or come up with a new emerging chemicals in terms of the biomonitoring. So we are always limited by the volume of the samples, you know, even it's archived, it's just very small, what's the condition and things like that. So I was wondering, I know that I'm serving the science committee for one of my colleagues in the UCSD, that Tina Chambers, and she has run the breast milk basically biorepository for several years, and she's continued doing it. So they have quite a bit of breast milk samples that could be so like in a small study, you know, to look for what are the new emerging chemicals, you know, in terms of the exposure in the Californians. I just wanted to bring it.
Thank you. Let's see, did we want to go back to the other question, or do we have any? Let's see, I'm looking.
Yeah, I think that'd be great to
Yeah.
review some of the other questions, but I do have one question to follow up on with Jenny, just to ask her. You mentioned biomarkers of gasoline related pollution. I did a huge report on gasoline related pollution. We had a workshop years ago to try to look for specific biomarkers. Are you thinking of anything in particular? I'm just curious, or are you just speaking more generally?
I was speaking more generally. I think in my mind, I was thinking of VOCs like benzene, but I was not speaking from the level of expertise that you could speak.
Okay, I just wanted to make sure there wasn't some new development that we should write down. But yeah, thank you for that.
All right, thank you. So let's see. Some of the other questions in addition to those that we have been discussing are, and I think some of this has been brought up a little bit already, collaborations to analyzing existing program biomonitoring data. the types of information that should be included in the data package to be shared with external researchers, and ideas on specific partners, and then options for additional biomarkers related to air pollution exposures. And do we have specific suggestions for additional biomarkers, and also for academic laboratories in California that could be collaborators to develop additional methods?
And I would also just highlight for those of, you know, your academic connections, just the question that Susan had about whether you have ideas for specific projects. So we're, you know, faced, because we have this ongoing funding that may arrive in July, we need to immediately jump on opportunities for building a biomonitoring study. So if anybody has suggestions of specific existing research projects that were alluded to, but any details on that would be fantastic.
Jenny.
So I don't know, I assume you have approached already all the AB 617 selected communities, or is that something that I might suggest could be done? Like, for example, our recently selected border community just selected a few months ago, and they actually are going to have an ongoing project where they have indoor and outdoor measurements of air quality near the US-Mexico border. So I'm just, but that's only one of many communities, and I wasn't sure if you've already formally reached out to communities, or that's something that I might recommend.
I will just chime in, and then Susan perhaps can add to what I say. So you may recall, or you may not recall, that we actually visited all the AB 617 communities at that time, and we definitely are in connection with communities, and we are in connection with ARB and air districts. However, this kind of information that you have is really useful because there's so many communities. So knowing about a specific project that we might tag onto is really helpful. So thank you for that. And please keep those suggestions coming. I don't know, Susan, did you want to say anything else about community connections?
No, I don't think so. You know, we've been trying to keep on top of what's going on in the AB 617 communities. But, you know, through attendances at meetings, a lot of times we can't attend them, but, you know, we've got the recordings and we're hearing through our CARB colleagues also what's going on. You know, we also are interested in doing studies beyond the officially designated AB 617 communities, because there really are a lot of heavily impacted communities that, you know, aren't officially designated through the program. But yeah, so yeah, so I wouldn't say that we, yes, so I don't know if I have much more to say on that. I do think we also have been reaching out to researchers. You know, I've just been reaching out to former colleagues that I've worked with to find out, hey, are you doing, you know, any studies right now where you're enrolling folks? And, you know, what other kind of data are you collecting? And so, you know, if anyone has any, you know, ideas on people, I know, Ulrika, you mentioned the thing in Santa Ana. I'd like to follow up with you on that, you know, later.
Yep.
If anyone else has ideas like that, we'd certainly love to hear them.
So is there some place that we have a record, or that I could know who you've talked to? And I'm thinking, for example, in Imperial Valley, which has had a long running project. I mean, they're very interested in pesticide exposures. Have you had specific discussions about that with them? Or, I mean, I guess I'm asking two things: how to know. I'm asking how to know, and how to facilitate. I'm asking those two separate things, I guess.
We've had contact with many communities over the years, direct contact through the SGP, consultations through listening sessions. But regardless, I would encourage you to share whatever idea that you have. I also want to just split it into near-term and long-term, because to build a truly community-based participatory research project, that's going to be a effort over time. So we're also interested in studies where we could add a biomonitoring component to a study that's already up and running. So we're facing that. So it's two different things. So we welcome the long-term ideas. Obviously that's in our mind too, about building projects with communities across the state. in areas that we haven't visited yet. That's all part of our reason for asking for ongoing funding. But we're also very eager to hear, particularly in Southern California, if there's studies that are kind of already in that stage of having a community partner, having a good design where we could add on a biomonitoring component by, amending the IRB, something like that would be fantastic to hear about.
And coming from SoCal, I do have a couple of ideas in that regard. So I'll probably follow up with you about this. I think there's some very good opportunities if you're looking more for Southern California.
Great. And if they're short, you could name them here for everyone to hear, unless you don't want to do that. But if you have ideas that you can share publicly, that would be fantastic. Otherwise, yeah, you can email the Biomonitoring email or us directly.
Very good. I'm sorry, I didn't mean to interrupt. Laura was next.
I was just going to say, Laura, you have your hand raised.
Yeah, thank you. I was going to mention that in LA, there's a lot of interest on the part of community groups in understanding exposures related to oil and gas drilling, given all the oil and gas operations in LA. And there's a couple of ongoing projects that I think might kind of fit the bill of what you're looking for. So I might follow up with you about that. One that I'm involved with, and then others that I know about that I'm not involved with, but that are recruiting participants that live near urban drilling sites and are concerned about, VOCs and PAHs and things like that.
That'd be great.
Thank you. Let's see. Any other suggestions? While we're on that topic of specific studies that people know of that may be of interest. Jenny, you have your hand up?
I did. I just read following along on the methods development, I think was a point, one of the questions. In terms of getting a comprehensive California-wide sample, it seems like the infant blood spots would be at least a very large source. And I'm just wondering if further methods to be able to utilize those samples might be an area to at least get at the statewide surveillance issue.
Narissa, did you have a comment on that?
Sure. Yeah, I mean, it certainly is very thorough coverage. It's over 90%, I think, of newborn babies, and all of those are biobanked. It's not just from particular counties. I think there has been a review really recently from Dana-Barr, and I think it's 2021, where they did look at the state of the science of newborn blood spots, particularly for PFAS and POPs. And there are still a lot of kind of method issues to work out. But there was also, I think, some work done for metals, particularly lead and mercury, coming from a different group. That was kind of looking at how predictive the XRF of a newborn spot was with like an ICAP method on whole blood. And it looked pretty good. So I think, excuse me, I think those would be areas like this is like the long-term where method development and validation would be really something we might want to look into to get at this this question of surveillance, and also a broader set of analytes that we could look at.
Can you remind us which analytes have already been looked at by the program in those blood spots? I recall, were there some POPs, if I'm remembering it right?
For the newborn blood spots, I think Jean-Wen has done some work with PBDEs, and I think cotinine, but which is not part of the biomonitoring program, but I don't know that there's any other work that's been done by the program. And I should clarify, the McGill work on metals was not newborn blood spots. It was blood spots deliberately created for this metal assessment.
Thank you. Other comments? Jose?
Yeah, this is more of a brainstorm than a comment. We're in the middle of a pandemic with COVID being screened for a good amount. Are there any groups that are collecting a lot of samples from all over the state that could be another partnership that could be a benefit. And I don't know, it's just a brainstorm.
There is seroprevalence work being done at the state. I think we maybe talked about this last time. I think it would be complicated to try to get our consent work, get the appropriate consent on those samples. And obviously the COVID work is running fast, and it's a complicated group to get involved with because they're already dealing with so much. But certainly as we see these kind of public health efforts and COVID turning into something that we monitor over the long term, getting involved with other surveillance type projects, it is something I think we should keep an eye on.
I have a question related to the air pollutant biomarkers. Can you remind us whether the nitropyrene measurements, whether that's something that the program currently has capacity to do? Because I recall that there was a partnership with the University of Washington on that.
That's right. And no, the program lab has not developed that capacity. I will just say that it's a very tricky method for certain reasons. And, the outside of state contracting is also potentially tricky. It's definitely, obviously, an important thing to pursue, and it's on our list as a priority to figure out how to address. So I'll assure both you and Jenny about that. We're very aware of how important that is. And, that's something we can report back on in the future. And we'll also be keeping an eye on the science in terms of the ability to measure that biomarker.
Okay, thank you for that update. Other questions, comments? Jose?
Yeah, I don't know if we can talk about this, just kind of jumping back on one of the presentations, talk about the Stockton air pollution. Well, unless, I know this is not one of the questions you have, so I can defer this later on unless somebody has some question or answer specifically to the topics they want to discuss.
Go ahead, Jose.
Go ahead.
Yeah.
Okay. So I think trying to find solutions to problems and doing research on that is great. And so I guess coming back to the discussion that we had earlier on this regard, what are your thoughts right now that you've done the intervention here with these 18 parent-child pairs? And one more question underlying that too. We're also, I see the parents were involved. Did they also provide samples, or is it just the students?
Yeah, the parents did not provide samples, although in the biosphere study, we will have matched parent-child pairs of urine. So we will be able to see, differences between adults and kids. In terms of, where we go next on, air filtration, I mean, we haven't seen our results yet. I kind of want to see how things, shake out. There are still many communities that are using air filtration in schools and other ways to reduce exposure. So it's definitely a research question of real interest. And so we're keeping it on our radar screen, but we don't have any specific plans for following up on it right at this moment.
Yeah, I mean, just because there may be some statistical limitations that you may hit, given the small sample size.
Yeah.
And whether you see something or whether you don't see something, yeah, I mean, it's something to start thinking about in a way in advance, right? What if you don't see any signal, but you see a little bit, maybe a trend? Is that enough for you to say, maybe we should do a slightly bigger study to make sure that this is right? Which a lot of times with very small studies, it tends to be the case, right? You don't see anything significant just because you don't have the power to detect that difference necessarily. Right. But maybe you can see a little trend going in a certain direction. So something to think about in that piece. And of course, the other piece is the methodology. And I think that's one of the questions that Tom had about compliance, right? How sure are we that there was compliance during those 4 days? And the other side of the equation is you're not sure if they had it on the whole week, and what does that do to the whole piece, right? I mean, it would only strengthen any differences if that's something that does work. However, there's some questions with the methodology, right, that are a little bit challenging and need to be disentangled. And then And then the underlying thing, of course, is the lack of a control group. Now, pre-post in this case, given that it's a short amount of time, maybe is all right. But in the ideal world, we would have a control group that did not have anything, and we can compare it with that, right?
I'll just say two things. Yes, acknowledged about the small study size, and we certainly plan and hope to do a larger study. I'll also say that there's a lot of other work going on to test the efficacy of air filtration in schools, and CARB is working on developing a study like that in schools. Hopefully that will come to fruition. So we're quite aware of that. We're limited by our study design, and that could be an issue. So just acknowledging that. I'll also say, just to make sure everyone's clear, this wasn't a classic, quote, intervention study exactly. You know, we had certain classrooms with the filtration and certain classrooms without. So it's the before and after school that we're looking at. So it's embedded like in each student, really, that like before they come to school, after they leave school, do we see differences? And then between classrooms with and without. So as Susan showed our schematic, we have all this complicated, you know, comparison to do. And you're right, we won't have power, you know, to look at it all. But I think we might see some interesting patterns, and we'll definitely be reporting back on that on a future meeting.
I actually had a kind of a related comment, and Susan, I think you mentioned that you left the air filtration filters there, but that as far as, but you don't know, or you think that they're not using them. I mean, I would think that would be really potentially very useful information, certainly for designing a future study, to know, you know, if they're not continuing to use them, why not? You know, is there anything that could be done to improve usage of them, especially if you find that they're beneficial?
Yes, definitely. And it's actually, we just recently, you know, we're looking at just the purple air monitoring that's been done, you know, since the study was over. And we have a student looking at that, and she made note of that. And we actually, I have a appointment to speak to the principal next week about a number of things, following up on a number of things on the projects. And that's one of the issues I wanted to bring up.
That's
I'll
great.
also just chime in to say that I don't know, Susan, if you touched on this, but the reason that we used IQ Air is because we were dealing with a school that didn't have embedded air filtration in their system. So we wanted to look at the effectiveness of air filtration that's similar. However, we now are, as part of our project, we wanted to also help the school by purchasing MERV 13 filters. So that would go straight in their HVAC system. So that's in process too. Now we won't be doing biomonitoring before and after, but we could look at like what Susan's saying, the purple air results before and after installing the MERV 13. So that's another little extra add-on for this study that we're currently planning.
Yeah,
That's great. Thank you. And Jenny, you've had your hand raised for a while.
Hi, thank you. Since Jose opened the door to stuff that would be great to do, I think that it is really important to communities to find solutions. And so expanding from filtration or other solutions, I think we should think about partnering with state geographers and looking at tree cover and other issues, greenness issues with biomonitoring might be a very powerful way to look at that as a solution, whether it's just general greenness or tree cover, or, you know, even barriers where they have freeways with trees along them and then freeways where they don't. I just think that would be a solution of interest to the communities as well. And even though it's not helpful in terms of climate change to really promote air conditioning, it really is better to exercise in a clean environment like an air-conditioned gym or building near a freeway than it would be to run around and breathe direct exhaust. And so I think also perhaps documenting benefits of those kind of clean air exercise environments, because for children especially, because they have, you know, such huge uptake relative to their body size, might be an area where we could demonstrate a solution to communities. I think that's very powerful. As well as, of course, we already mentioned before, looking at changes in policy, looking at what has California done with clean diesel, and even after that has arrived, what disparities could still exist, you know, near the border in San Diego, for example, where we have a lot of older vehicles or vehicles from Mexico or whatever. Where would the disparities still linger, or else in Carroll County as well? Where we saw that with flame retardants, that the benefits reached more affluent people quicker than they did people of less means. So anyway, so just kind of looking at those issues. Thank you. Again, but kind of a future direction. Thank you.
Thank you.
Susan, did you want to comment on that you are in fact attending a meeting on barriers? So that's on the radar screen for communities, and we're staying in touch about that sort of mitigation strategy. I don't know if there's more to say than that, but.
Yeah, probably not yet, but it's certainly a strategy that is, there's a lot of growing interest around that. And, you know, whether or not biomonitoring can add something to that or not, you know, we're going to look into it and, yeah, see.
I'm wondering, I don't know if there are more hands raised, but maybe this would be a good time, Cheryl, to chime in with Dr. Sumchai's latest comment. And I would say just paraphrase pieces of it. Since it's rather long, it's in the Q&A.
Right.
We'll capture it in full.
Okay, and I just saw Jose raise his hand, and
Yes.
maybe there's others. There's a comment from Dr. Sumchai. Thank you. Hunters Point Biomonitoring will be meeting with Dr. Terry Hamilton, who leads the Marshall Islands Plutonium Biomonitoring Program for Lawrence Livermore Laboratories next month. We have historical and environmental survey work that supports our belief we have a plutonium exposed population at the Hunters Point Naval Shipyard Federal Superfund System, where up to 90 Operation Crossroads ships were docked. The Navy has detected plutonium-238 and 239 in concentrations 44 times higher than background. I raise this point for two reasons. Given world events, we should be looking at biomarkers of radiation exposure. And I also want you to look at the very sensitive and specific mass spec capabilities at Lawrence Livermore and Los Alamos UC facilities. And I read the whole thing because I didn't know how best to paraphrase that, but thank you for your comment.
Yeah, thank you very much. And thank you for reading that. Jose?
Yeah, I mean, that's a very interesting population, similar to the firefighters too, with unique exposures. I had some comments maybe about the website, if you want to talk a little bit about that, if that's of any use.
Sure, and actually I did want to, I thank you for your praise earlier, but the website has not changed. Everything you saw has been in the existing website for a long time. So I'm glad you found your way around it.
No. There were some changes though within the studies that I found it a little bit easier to navigate. And this
There's been no structural changes in the website. It might just be how we posted things, particularly. Anyway, doesn't matter. We don't need to quibble. Thank you for the praise. Glad you're following it. However, I will just clarify something Narissa said, which is we're working on the website. We actually have to undergo Drupal 9 conversion. So we have to update our Drupal that we're using, which is the platform that we use for the website. Our IT is now working with contractors. So this actually is an opportunity for more extensive changes, including to the results database. So I would like to just, we didn't put that as one of our discussion questions, but certainly, Jose, if you have thoughts, we'd love to hear them. And if others have ideas, you can email us at the Biomonitoring California email.
Yeah, maybe, could I share my screen then?
I think so. Elizabeth,
I'll
can
give
you
it a
allow?
shot there.
Jose has the authority to share. There you go.
Great. So hopefully I'm sharing the biomonitoring website. Great.
Yes.
So, so this part right here, I really like this page that I'm going to open a separate tab here. And then of course you can click on all of these different studies that are very well laid out. And then now we can see all the different chemicals within each one of the studies. That page is so good that I feel like this little link here is a little too small to make justice.
Yeah, I'll just say that's already being addressed. So don't pay attention to landing pages. That particular page has bothered both Dan Sultana and I for a long time. That will be addressed. In fact, all of the buttons at the top, if you hover over those buttons, Jose, the buttons, if you hover, you get that menu. If you click, you get a landing page. The landing page function will be gone. So we're going to be looking at which landing pages we want to capture. They'll be part of the menu, and we will definitely be revamping. So agreed on that. I don't actually know how that strange link got in there, but we agree it's non-functional.
Oh, okay. Okay. And the other piece that I was mentioning that would be nice would be to have a tab for researchers. So that's what I was trying to get at with the visual piece. So you have the projects, results, resources, and one tab specifically for researchers that they can click on that. I don't know if the closest thing will be resources, but maybe not.
I think we have, if you hover over results, we have a tab, we have a page for researchers, information for researchers.
Okay, got it.
Yeah.
Look
Now,
at results.
that's an old page. So this is something that Narissa was alluding to in terms of updating it and adding information like the data package. I will tell you, Jose, that I appreciate your suggestion for a specific tab, but those are limited. So we have to choose, we have to be judicious about what we make a main tab. We can't add more main tabs. So if we add a tab, we have to take away a tab.
Yeah, I mean, yeah, it depends on how much of a priority you want the collaboration. So the more attention you bring onto it, the easier you make it for the researchers to access, the more they're going to do that. So I think that's one of those things, worth pondering how much attention, or make it so that maybe you can call it, results is good, but in a way so researchers can very quickly get to that point. And then the next stage is, of course, what data you want freely available that people can download or investigators can download, or which not, which like the counterpart would be like NHANES, right? They try to put us everything pretty much out there, and you can download it from the different sides of things. So, I mean, that's something I think for you to decide what kind of information you want to be easily available, and having the least amount of barriers for people to download ultimately.
Sure, and we'll take that into account, and Narissa will definitely be thinking about that. That's something, like I said, we're thinking about the redesign of the results database. So if you have suggestions, I'm just noting we have only 3 minutes left. So Ulrika, I think this is probably a good time to wrap up.
Yes, so does anyone have anything else that they wanted to comment on related to these discussion questions? Now is the time. Right. Not seeing any additional hands or questions in the chat. Jose, your hand is up. Do you have a new comment? No? Okay. All right. Then I think we can move on to the next topic. So I don't think Sarah needs any introduction, but I'd like to introduce Sarah. She is the chief of the Safer Alternatives Assessment and Biomonitoring section of OEHA, and she's going to report back on the Buck et al. 2011 definition of PFASs, following up on a discussion that we had at our previous scientific guidance panel meeting. So Sarah.
Thank you. Okay, so I'll at first ask if people can now see that.
Yes.
You can.
Fantastic. Okay. And actually, sorry, we were testing this earlier, so it's further down in the talk. Okay, so as Ulrika just said, I'm reporting back on the Buck et al. Definition. And the first thing I'd like to do is I'd like to acknowledge Kathy Durkin, who is director of the Molecular Graphics and Computation Facility at UC Berkeley. She did some really helpful background research for us on this topic, and we had a number of discussions to help us sort some of these more complicated issues out. And I'd also like to thank Simona Balan and Tom Bruton of DTSC's Safer Consumer Products Program for their input as well. And the first thing I want to do is remind everyone that this is an informational item only. It's not a voting item, so we're not going to be making any decisions on changes to the definition today. We've only just begun delving into the extensive literature on defining PFASs and other fluorinated compounds. So really today we just want to illustrate what we found so far in terms of Buck et al., suggest possible next steps, and receive input from the panel and public on directions we might take. So in terms of some background, just to bring everybody up to speed of where we are, we do rely on the Buck et al. 2011 definition for PFASs. PFASs as an entire class were recommended by the SGP for addition to the list of designated chemicals in March 2015 and the list of priority chemicals in November 2015. And then, as was mentioned at the last meeting, we had a focus on PFASs, and we were asked to take a look at the Buck et al. Definition in terms of PFASs that may be missed. So I'm now going to walk you through some excerpts of Buck just to illustrate some of the interesting things we identified. So this first excerpt is sort of their first overarching definition in which many people, including us, have cited. I've highlighted some key elements. So PFASs are defined as aliphatic. That's a significant restriction. In which one or more carbon atoms have all of the hydrogens substituted with fluorine atoms in such a manner that they contain perfluoroalkyl moiety shown, which is a part of the chemical that has this formula, CnF2n+1. So, next slide. But Buck et al. Go on to say more explicitly, we recommend that the family of compounds denoted by PFAS should encompass perfluoroalkyl substances. In this case, you have all of the hydrogen atoms attached to carbon atoms replaced with fluorine, except if it were to affect the functional groups. So hydrogens on functional groups obviously are not replaced. Interestingly, you will see that this bullet on perfluoroalkyl substances does not mention the moiety. So that's an interesting point to note. Polyfluoroalkyl substances are similar substances, but in this case, it's just at least one, but not all carbon atoms have been replaced, have the hydrogen atoms replaced by fluorines. And here they do emphasize the moiety for polyfluoroalkyl. And the reason that they emphasize this moiety, if you read down this complicated text, is because they want grouped fluorines in polyfluoroalkyl substances and not fluorines scattered across the molecule. So that seems to be key function of that moiety in Buck et al. Next, I'm just showing you this figure, Buck et al., which is actually a very helpful figure. We've retyped it for clarity. And I'm going to just point out a couple things in here. It's called the classification hierarchy of environmentally relevant PFASs. And there's some things to note here. First of all, again, they don't talk about the moiety. They just pull the main definition of the per and poly substances. I want to draw your attention to this line, aliphatic PFCs. That's a very broad term that has a particular meaning. I'll be showing you on the next slide an example. It may or may not have the moiety in aliphatic perfluorocarbon. And then fluoropolymers is also of interest, carbon-only polymer backbone with fluorines directly attached. So here are just some example chemicals to try to give you a picture of what we're talking about here. Here we have PFOS, which is clearly a PFAS. It has the perfluoroalkyl moiety. You see the C8F17, which meets the criterion, and it's attached to a functional group. Here we have an example of an aliphatic PFC. So according to the table I just showed you, it should be considered a PFAS. It doesn't have the moiety. So most people would interpret Buck et al. As excluding this. Not everybody. So there's, you could read Buck in different ways. If you don't apply the moiety as a completely restrictive criterion, this would be included as a PFAS. So coming to the polymers, this is actually a very interesting topic. We had a question come in about, is PTFE a PFAS? And I immediately looked at the structure and said, by convention, polymers do not have the terminal ends listed, and therefore you can't actually apply the moiety test because you don't know how it terminates. I did a lot of research on this topic. PTFE indeed does often terminate in CF3, but not always. So you can't actually apply the moiety test. I'll also note polyvinyl fluoride is included by Buck. Polyvinyl fluoride as a PFAS, I will emphasize, this does not even have a single fully fluorinated carbon, but it meets their definition of fluoropolymer, and therefore they're indicating that fluoropolymers are PFASs. So that's also a little interesting point. Here are some more examples. Here I've shown two examples of Aromatic chemicals, we consider these excluded because it's very clear that bucket-all requires them to be aliphatic substances. So aromatics are not included. Here's another somewhat interesting example. Again, most people would say this is out because it doesn't have the moiety. However, it meets the definition of a perfluoroalkyl substance in every way. It has the hydrogens replaced by fluorines except on the functional groups. So again, the problem we're now, I hopefully in this very brief talk, I've illustrated some of the problems with using Buck and the definition, even summarizing the definition and making sure that we're not too restrictive and understanding what's in and what's out. So that to our first interim step that we want to implement, and that is to clarify the current PFAS footnote. Here you can read on your own, the current language on both our designated and priority list is here. Over the years, we've actually altered this definition for clarity. This is very clear, but now that we know the moiety is not necessarily a strict criterion, we think this is too restrictive. So we're proposing simplifying it for now, just to refer to bucket-all for the description of PFAS as an example members of the class. Obviously, that's not a solution that's going to be viable going forward. So we want to do more, and that is we'd like to evaluate definitions of PFASs from other groups. OECD is commonly cited. There's a lot of literature where people have proposed different things. We also got some interesting public comments that Ulrika will paraphrase shortly, and we'll be looking at those. We could consider adapting some very simple language that are being used in bills. One example is shown here. And something that I've been heading towards, and I've talked with Kathy Durkin about, is could we develop a definition that really addresses our program needs and priorities? For example, we could keep a reference to bucket-all to make sure we retain all currently listed PFASs, including specified polymers in bucket-all, and then add a phrase to expand the definition to ensure that we capture all the relevant fluorinated chemicals that are not currently included by relying on bucket-all. And so this is not necessarily an easy path either, but it's something that would be great for you all to think about and provide us suggestions on, both the panel and the public, about what would be the things we'd like to capture. Obviously, we would think aromatics would be important to capture. There are other things that are missing by relying on Buck. And as we've all talked about in the past, our class approach has been to be inclusive, to try to be inclusive, to allow us the broadest flexibility in what we measure, because we are not a regulatory program. We are an exposure-based program, and the list of designated chemicals is really a lab list we can measure. That's why we favor being more inclusive instead of less inclusive. Now, I also just wanted to note that Venus Singla has raised the idea of considering functional if there are concerns about being overly broad and including things that maybe people don't think should be included. So that's an option that we could consider. So today, all we really want to hear about is any input on the simplification. That's just the interim step, as well as suggestions on what directions you'd like us to go in terms of our further research. And now I can take some questions if people have them.
Thank you, Sarah. Looking to see if we have any raised hands.
Oliver, was that a raised hand? It came down again.
Yes.
Oh, okay, Oliver, yes.
Yeah, I wonder a little bit about I do understand the idea of class definition. The PFAS, alkylated PFAS are already defined as a class. If we now use partially fluorinated aromatics and add them to it, I wonder if possible biological mechanisms or hazard potentials are even related. So at this point, I am I would like to see a little more data to say, yeah, the fluor, because the fluor atom itself is not, I don't think it's actually the problem, right? Unless somebody shows me the data, right? So if something has an aromatic with a fluorinated methyl group on it, I'd say, yeah, I think is still different to an alkylated, polyfluorinated alkylated compound. So that's, unless there's clear data that says exposures and hazard potentials are similar.
So I want to just say, yeah, thank you. I acknowledge what you're saying, Oliver. And I did want to clarify that if we were to bring back a proposed change, that would be a voting item, and there would have to be a document written to justify that change. So yeah, you're right. It would have to still meet the criteria, and the panel could decide. Now, again, we don't have to meet every criterion for designated chemicals because it doesn't necessarily have to be shown to be toxic. It could just be an exposure concern. So we have some flexibility in our law because it's not regulatory. So just keep that in mind.
Carl?
A quick question. In a way, it's a follow-up to Oliver's. Does anybody yet have enough information about the things in this class to push them toward more toxic, which would be more worrisome, and less toxic and so forth? Or is it all so new that you can't say much about it?
It's definitely not also new. There's legacy PFASs, which obviously are of great concern.
Yes.
I don't really have more comments than that. There's definitely a lot of PFASs that have not been studied, maybe not even the structure characterized fully, that sort of thing. So it's a huge class of compounds. But others, Unhai, see you're showing your camera. If others want to comment on that, please feel free.
Unhai, did you have a comment? Yeah.
Oh yeah, I think Carl was the first.
I think that was that your comment?
That was Carl's comment. So we're asking you if you want to respond to his question about toxicity. Is that why you showed your camera? If not,
yeah, I mean it's more like a broad question, that it's such a, because now we're finding more and more fluorinated organic chemicals because of the advancement of the analytical methods. And then the toxicity data is not necessarily following up, the catching up, the finding of the new fluorinated chemicals, So I think I'm just wondering if Junsu is a really expert in the non-targeted, also targeted way of fluorinated analysis. I kind of wonder if he's here, he can kind of I'd like to hear what his thoughts about it.
Well, we've conferred with DTSC, Sabrina, Jinsu, and Safer Consumer Products. Certainly, allowing for a broad screen is one argument in favor of a broad class, right? So if we do non-targeted screening, you're going to be capturing a whole bunch of fluorinated chemicals, as you say, beyond what we're even aware is out there. And I think that was commented on in the November meeting about some, there's a big chunk of organofluorine that we don't even necessarily know what it is. So that's really what I was speaking to. But I just did want to make sure, Carl, did we chop you off before you finished your comments, or was that your main question?
That helps. I guess I was concerned. There's broad scale screening because there's concern about what these things can do when people are exposed to them. But if the screening is too broad, does it waste time or waste resources or mislead you as to what needs to be done?
Well, I guess I'm going to answer that in two ways. One is, if we a broad listing, we don't have to measure everything we list. So concerns about, but if you do a broad listing and then you get pharmaceuticals and you get all these things that are irrelevant, not to say that pharmaceuticals are necessarily irrelevant, because they're also an environmental hazard of concern that we've talked about at past SGP meetings. But just having something on the list doesn't make us have to measure it. It just allows us to be broad. So I think that's an important thing to keep in mind. I think that, to me, screening is always useful. It doesn't necessarily give you answers, but I think it's fascinating. A broad screen and you get a chunk that you don't know what it is. That's an important piece of information in and of itself to me. Anyone else on this topic?
Thank you.
I mean, I would just, put in also a word for, I think having a broad classification is useful because we don't, as you said, there's so many, we don't even know what they are. We don't know what the toxicity is, and that provides flexibility, as more information becomes available. So I would be in favor of that. Any other comments? Tom.
Well, I want to speak in concurrence with that position that, there probably could be nothing more troubling that could happen is if we restricted the definition in some way, and then another compound comes along, which might have been in the class, but we were restricted and it's toxic and it's ubiquitous, but the state and others can't deal with it because it's not included in the list. So, I think it makes sense to keep it broad and not restrict. I think we should be working, and again, the point is that, and people misinterpret this, when we put out a class of chemicals, we're not saying they're toxic or harmful. What we're saying is that this is a class of chemicals in which there are issues of concern, whether the exposures are going up. Some members of the class have been demonstrated to be toxic. So putting the class out gives everybody involved the opportunity to have a broad list of chemicals to work with, and they don't have to measure all of them. It's the reverse is much more problematic.
I'm thinking, Ulrika, this might be a good time to read the paraphrased public comments in the chair's agenda, and then we have a few attendees that want to speak, so we can bring them into it.
I do see that Carl had raised his hand. Carl, did?
Sure, Carl, if you have a quick thing and add on to this.
A quick thing in favor of a broad definition. If you pick up something that's suddenly on the increase that you hadn't anticipated, that may be a reason for looking into it by the agencies or people that worry more about the toxicity.
Exactly, and I think Tom said it really well. There's multiple criteria for putting something on our list. They don't all have to be met. You might remember we always say those criteria are not joined by and. So
Right.
That's an important consideration.
Right.
Okay, back to you, Ulrika.
All right, thank you, Sarah. So what I'm going to do is that we received 2 public comments on this topic before the meeting, and so now I'm going to just paraphrase those public comments. So the first one was from Stephen Brown, a PhD chemist leading the Sierra Club's PFAS grassroots action team, who submitted a comment as a private individual on the topic of, and this is a quote, defining PFAS as a chemical class, which is necessary for regulations to protect public health, given the impossibility of adequately testing, let alone measuring all the PFAS compounds released into the environment for decades, close quote. He provided a recent online summary of this issue prepared by the European Fluorocarbons Technical Committee, and the link to that is available on the March SGP meeting page. Stephen also stated that, quote, I would opt for the definition provided by Denmark, Germany, the Netherlands, Norway, and Sweden in the PFAS Registry of Intentions, ROL, which is most restrictive, but which may not be accepted ultimately by OECD. Manufacturers will prefer consistency worldwide, so the OECD definition would be acceptable if it isn't revised per the ROL proposal. The California SB 1044 definition would lead to ambiguity, close quote. The second comment is from Amy Kyle, Associate Adjunct Professor at UC Berkeley, who recommended that OEHA ensure the PFAS definition reflects the evolving understanding of this diverse and ubiquitous class, write up an analysis of the strengths and weaknesses of various approaches for defining the class, consider the PFAS definition used in SB 1044 as it is increasingly being used in California legislation and elsewhere, and consider which definitions would be most functional for addressing compounds that are not fully characterized. So
before we move on, I just want to correct, it's not ROL, it's ROI. So,
ROI, yes, intentions, got it, sorry.
ROI. Just
I was like,
okay.
Why is it ROL? Sorry.
Yeah, right. Yeah, you can't tell with that font. Sorry about that.
All right, thank you.
Okay, and now I'm going to suggest. Oh, I see Carl has his. Do you have a hand up regarding those comments, Carl? Okay, so why don't we go ahead and proceed to the other comment? I think Cheryl, you got one, and you also have attendees to call on. So please take over.
Yeah, there's two comments in the Q&A. Stephanie, did either of these commenters want to speak themselves?
Sure, I can go ahead and start with the attendees who have their hands raised, and we can start with Amy Kyle. I'm going to unmute you, and so you should be able to then unmute yourself and speak. And next we will go to Avi Carr.
Thank you. I didn't realize I'd actually figured out how to raise my hand. So this is extra special. It's nice to see you all here. And I'm so glad that this great group is thinking about this issue. And you read my comment that I sent in yesterday, so I won't repeat that, but just maybe emphasize the special needs of compounds like this that are really, I think, so important because they're everywhere. And they're toxic, some of them at very low levels. And yet we don't know what all of them are, and we can expect the mix of them will continue to change. And so how can we define that? You know, that it's kind of a rolling situation that we want to be able to understand as much of it as we can as we go along, even though what was true last year won't be true next year. So it's an unusual kind of problem, I think. And a lot of us, I've talked to some other people working on this issue who are delighted that OEHA is thinking about this and the science panel. The other thing I wanted to say is there's also the components of the persistence and mobility of these compounds that are related to why there's such a concern. So it's partly the health effects, but also because some of them may never break down. And so I don't know if that needs to factor into the definition, but I think it needs to factor in how we think about them and how we decide whether they're important or not. Because that, you know, this stuff is showing up in water and it's showing up in people. And if it's as persistent as some people think that it is, it will only continue to get larger overall, though the exact compounds may change as the industry changes what it uses. So there are some unique challenges here. And I thank you and Sarah for taking this on. Thank you.
Thank you, Amy. Did the other two Q&A folks?
Yeah, I think we have both Q&A. So I was clarifying that with Stephanie. I think there's maybe other attendees who've raised their hands. So
yep, we have Avi Carr, if you'd like to speak.
Yes, thank you. And thank you for this discussion, for the opportunity to comment. My name is Avi Carr. I'm an attorney with the Natural Resources Defense Council. And I worked on SB 1044, which is one of the definitions under discussion here. And I wanted to offer a policy perspective for this discussion to the extent that it's helpful. We urge the panel to consider consistency with the existing definitions because the 1044 definition is in use in multiple California laws. And it's also in use in more than 10 different states, that same definition. And the other one that we think is in widespread use is the OECD definition that's been referenced. And to avoid confusion, we think it's helpful to have a consistent definition or a consistent set of definitions that are in use. And to the extent that Biomonitoring California is seeking to specify the PFAS that it monitors for, as the discussion has indicated, that can be done separately from the definition. And so we're urging keeping that in mind, especially because of some of the considerations that have been outlined earlier, which is about regrettable substitution and regulating a limited set of PFAS if their definition isn't quite consistent with what's out there in the broader usage, the potential for other kinds of PFAS to come into play. So I hope you take it in the spirit of the policy perspective. I obviously am not a scientist and can't offer a scientific perspective on it. So thank you for the time and thank you for your attention to the issue.
So Avi and others and Amy, I want to emphasize that although it appears that the 1044 definition is very broad, that's what I was trying to highlight in my talk. There's chemicals listed in BUC that would not meet that definition. So that's what we're looking at. We're looking at wanting to retain what is already listed and then broaden from that. If we, so, and there's so much confusion and difficulty when you start to, everybody has a different opinion about how to deal with this. If we keep BUC and broaden BUC, I think we're going to be broader than anybody, truthfully. Like that's where I'm leaning towards. I might be wrong, haven't delved into it, but you got to remember that you're going to lose fluoropolymers if you go with your fully fluorinated carbon definition, at least the way that BUC defines polymers. So that's just something to remember. We're not trying to keep our definition restrictive. We're actually trying to look at the most practical way to broaden it. I'll say that and pass it back to Stephanie and Cheryl for other commenters.
Okay, yes, we received 2 comments in the Q&A, but both commenters now have their hands raised. So I'm going to first call on Nancy. You should be able to unmute yourself, Nancy Biermeyer.
Hi, thanks very much. Appreciate the opportunity, and it's always good to see the panel at work. Been obviously a longtime supporter and fan of all the things that the California Biomonitoring Program does. I just wanted to reiterate what I said in the chat or in the Q&A, which is that broad is really important. Certainly I work with Avi a lot, and we have used that definition, and the consistency is one piece of it, but the list that you guys define is also used in other ways in California legislature, specifically in a couple of the disclosure bills around cleaning products and fragrance. And that those lists sometimes get replicated in other states, or at least the potential is out there. So the broader you define it, the more disclosure we get, and that's super important. And it is really important to us that the polymers be included. Like PTFE has to be included in these bills because so much of the products that we're concerned about use PTFE, particularly like the cookware bill that we did last year, which it was a bill that banned PFAS in food packaging, but disclosed it in cookware. So those are super important things to keep in mind. I also don't understand the science, so that part I leave to y'all.
Let me tell you, it's complicated. So I'm going to just say that. But I also will point out that PTFE does have a fully fluorinated carbon, so it would be captured under that definition. I was referring to the other example that I showed.
That is excellent news.
Which would be lost. But this is exactly the kind of thing that we're going to look at. Like if we go this option, what do we gain? What do we lose? Etc. And definitely, as you know, we were pioneers in the class approach, and we're definitely in favor of being inclusive. Go ahead, Stephanie.
Okay. Next we have Renee Sharp.
Hey, can you hear me?
Yes.
Great. Thank you all for having this discussion today and for allowing us to provide public comment. My name is Renee Sharp, and I am a scientist with an NGO called Safer States. However, I'm not a chemist. And sometimes I think that when you come to these really wonky questions, I'm wishing I was a chemist. But my comment is consistency really is very helpful. And, echoing the comments of some other earlier commenters, using the definition that's used in the California bills or laws and also used in other states, or using that more recent OECD definition can be very helpful. That said, we are also very interested and feel that's very important to have the definition be broad as possible for all the reasons why several of the panel members mentioned, making sure that if something comes up, that you're not hamstrung kind of by accident or by intention to being able to actually take action to monitor for that compound or otherwise address it. So given that, if you think that either the definition in the California legislation or the OECD definition is not broad enough, I would encourage you to take one of those and start there and broaden it, rather than using BUC, because at this point that BUC definition, it's 10 years old, and in the spirit of consistency, it would be better to kind of take an existing updated definition and kind of go from there, rather than kind of feeling like, it kind of feels like you're kind of like taking an older one and then trying to improve upon it. I think that would be, it would just kind of be helpful for consistency and perhaps moving the field forward. So thank you again, very grateful that you all are considering these questions and appreciate your efforts.
So Renee, I will say, I hear you, I acknowledge this point. However, actually, there's so much inconsistency, even in the current literature, including about OECD. There's issues in the OECD paper where things are excluded that I don't think we would necessarily want to exclude. So it's actually really complicated. And this is something that we need to take a closer look at. One of the main reasons I'm favoring keeping, I know BUC is outdated, everyone points that out, but BUC is where we started, and it's foundational for defining this class. And it also has certain broad aspects that no other definition has. So that's where I was going with that. Certainly we can abandon that idea. We don't have to pursue it. We could talk about the definition in a different way and then have reference to many different papers. I mean, there's lots of different ways we can go, but I just wanted to really, that was an interesting point that I discovered and I was surprised by. And I will also say that Kathy Durkin reached out to BUC, and we have not heard from him yet, but we definitely will be trying to confer with him as well about his thoughts in this area, and others, of course, other stakeholders. So yeah, and again, any additional comments, send us emails about your favorite definitions or new language or new papers. We'd love to hear it.
Thank you. I don't believe that there are additional public comments. If there are, please raise your hand or in the chat. So not seeing anything. Any additional comments from panel members?
And let me just chime in with one question, and that, oh, Tom, you can go, but remember, I'm planning to do this interim fix so that we're not restricting BUC to only things with the moiety. So I'm just going to assume, I haven't heard anybody object to that interim fix, but and that's not a voting item. We're going to make some clarification, but if anyone has thoughts on that, we'd like to hear it. But go ahead, Tom.
Well, you made a key point. So we kind of came into this and I had a sense that we have BUC, an older version, or we have something, and then there's other options. And it felt like, well, we either had to keep what we had and stick with that paper consistently or go to something else. But now it looks like we can start with that BUC paper and then come up with some, maybe the panel can do this, but just some guidelines about how to expand it. So, there's no reason, right, that we couldn't have 3 working papers and use that to have the broader one. Because I don't like the concept that we're going to say, oh, here's BUC, then we're going to go OECD, and then we're going to lose a bunch of compounds, even though we're going to gain some other ones.
Exactly.
I mean, that's a really, I think, dangerous game actually to play. And the best game, or the best way to do it, is to kind of build a portfolio of documents that support the choices we have, and then maybe vote on that or something at some point.
Exactly.
Okay.
That's my vision.
That
Tom,
really
thank you for saying it perhaps in a clearer way than I was saying it. And I do want to say that one thing that I really am aware of, and this is, I think, a point that others have made as well, that I don't want the situation, which we've been in many times over the years, where someone hands us a chemical and said, is this in or out? and there's not enough clarity in Buck et al. To make that determination necessarily. I could argue this is in, someone else would say it's out. So that's the other goal, is to clarify, okay, all of these things are definitely in, and you can look at the structure. You don't have to go to a paper and figure it out yourself. You can just figure it out based on our guidance. Is it in or out? That's the goal of the guidance we'd like to issue on the definition, which will be voted on by the SGP.
Great, thank you. I think we're just about at the end of our time to move on to the open public comment period, unless there's any last comments from panel members. Not seeing any, then I think we can move on to the open public comment period. So there are 10 minutes allotted for the open public comment period, during which commenters can provide comment on any topic related to biomonitoring in California, not just the topics that we were talking about today. And I did want to mention that, well, I think that Dr. Ahimsa Porter Sumchai of Hunters Point Community Biomonitoring Program submitted 3 links as public comments. One is HP Monitoring, Promising Hope for Hunters Point. Another one is HOPO, Partnering to Advance Therapy for Radiation Exposure, and Quest to Detect Plutonium. And so those links are available on the March meeting page under the open public comment period. And also, please, you can go ahead and submit written comments and questions via the Q&A function, as people have been doing, of Zoom webinar, or by email to biomonitoring@oeha.ca.gov, and we will read them aloud. If you wish to speak, please alert us with the raise hand feature in the Zoom webinar, and we can also call on you, as we have been doing. Do we have any additional comments, people wishing to speak? I'm not seeing any. Not seeing any. Has anyone else received any comments? All right, if not, then I think we can go ahead and wrap up the meeting. So I wanted to announce that, as always, there will be a transcript of this meeting posted on the Biomonitoring California website once the transcript is available. And also announce that the next Scientific Guidance Panel meeting will be on July 22nd, 2022 from 1 to 4 p.m. And attendees will be able to join that via Zoom webinar, or come to the Coastal Hearing Room on the 2nd floor of the Cal EPA building at 1001 I Street in Sacramento to participate in the webinar. So I want to thank all the panel members and the program staff and the audience. And with that, we will adjourn the meeting.
Okay, thank you. And thank you again, Ulrika, for stepping in at the last minute.
Thank you.
Goodbye,
Bye, everybody.
Bye.
Thanks, bye-bye.